Your average stay in hospital is 4.3 days, but you live in the community. That's where your health is impacted. 40% of health conditions are driven by education, job status, family support, income. And what is the community like? The community safety. The physical environment adds another 10%. So if you add that 40 and 10, half of the things in Sunset Park are driving your health condition.
Dollars are already scarce everywhere we go these days. So when you're looking at capital updates or anything that's related to the building, going to the right and clockwise, utility interconnection costs. That's one of the things we look at Con Edison all the time. What are the things we can do from a design perspective that enables the project to pencil out at a lower utility interconnection cost?
We have the basics on the infrastructure. If we're going to build a solar array, we've got to do a construction project. The good news is NYU Langone does a lot of construction projects, so this is something that we have a lot of expertise in, and we hope that we can bring that to the table in helping push the project forward.
If we do this right, we can make the economics work, and we can make it work with our facilities, and we can make it a very positive thing for our communities.